Water pollution in the Philippines. What is water pollution? So, water pollution is untreated, unfiltered wastewater that affects health by spreading disease causing bacteria and viruses. It is a microbiological exposure that can be found in contaminated drinking water at home, fecal contamination in lakes and rivers in the communities, and it can be spread pathogenic. It can it can spread pathogenic bacteria through major waterways and can globally spread the infectious disease associated with the climate change. Water can be polluted from human fecal waste, agricultural waste, industrial waste, chemical waste, etc. So, sewage water that empties into the oceans, that's how it kind of gets polluted in the Philippines. Most affected population. Urban populations are most affected seasonally by water pollution, which is about 30 million or more Filipinos. They will most likely have a water shortage in the next 10 years. 36% of the country's river systems are sources of public water supply, and that's a little bit, especially when, as you can see, most of them are filled with trash, so there's only so much water they can actually drink. 30% of groundwater tested showed that the nitrate levels were way above the WHO safety limit. And because they're big on agriculture, they're like bananas and coconuts and stuff. A lot of their agriculture consumes 80% of the water. And the region is also home to some of the poorest people in the world, and the water contamination kills about 55 people every single day. Forms of exposure: drinking water, sanitation, recreational activity, agriculture. So if your drinking water isn't clean, that's how you get sick. If you're not properly cleaning yourself and you're eating with your dirty hands, stuff like that, that's how you get sick. Recreational activity, swimming in the dirty water. Agriculture, if the food isn't cleaned with clean water, then you're just eating the contaminated water and the bacteria. Consequences of exposure. So known diseases caused by the poor water include gastroenteritis, diarrhea, typhoid, cholera, dysentery, hepatitis, and more recently, acute respiratory syndrome. And the long-term consequence is death. Prevention and treatment. So if families have a sanitary toilet, that's a plus. Or if their neighbors have a toilet, then you use your neighbors to do your best. Wash your hands with soap and water. Boil water before consuming it or using it, or chlorinate it before you use it. Diarrhea and cholera can be treated with oral rehydration salts and antibiotics if treated early. And other diseases can be treated with antibiotics or prevented with vaccinations. And addressing water pollution, ways to decrease water pollution: the elimination of all hazardous chemicals at all stages of production and the seeking of safe, sustainable alternatives, reduction of waste generated, decreasing of the need for raw materials and energy, and the utilization of clean, renewable energy sources in the production process and design.